If you've been waiting to get your Social Security or disability benefits for May 2025, your wait is almost over. I'm going to give you the May 2025 Social Security payment dates when your check is going to hit your bank account. I'm going to bring you all the details and what can President Trump do this year to improve the lives of seniors. There's so many ideas that have been floated around, but these 10 ideas are the top from our research that have the potential to change the lives of seniors this year. So stay tuned to the end of this video as I walk you through these 10 ideas that the president can really get behind and change the lives of seniors this year. My name is Kwame Kwade. I am a personal finance expert. I am also an entrepreneur. For 15 years, we've been creating content to help seniors get the retirement benefits they deserve. I'm also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. Now, if you're new here, hit the like button, hit the subscribe button. We really do appreciate your help and support. And as always, I want to know where you're watching this broadcast from. Let me know your city and your state in the comments below. But let's dive in into the May 2025 Social Security payment schedule. If you've been waiting for your Social Security or disability check, the wait is over. The first round of payments are going to start next week, and payments worth up to $5,108 are going out soon. That is the maximum benefit that you would receive if you've paid the maximum into Social Security, and it requires you to wait until age 70. But if you're retiring or getting to your full retirement age this year in 2025 and you've paid the maximum into the system, you will get up to $4,018 in 2025. The full retirement age, if you are born 1960 or later, is 67 years old. Now, if you're retiring early at 62 and you've paid the maximum into Social Security, then the maximum benefit you can get at age 62 in 2025 is $2,710. But of course, the average benefit, when you take all the Social Security recipients and you average that, it's $1,925 in 2024. As I mentioned, the retirement age, the full retirement age at which you get all your benefits that you've paid into the system that you deserve or are eligible for, is going up in 2025. The full retirement age is 66 and 10 months. Starting next year in 2026, it's going to hit 67 months permanently for those born between 1960 and above. But we're here to talk about your Social Security payment schedule for May. As you may know, if you're on Social Security retirement benefits or survivor or spousal benefits or Social Security disability insurance, which is otherwise known as SSDI, your payments are based on your birth date. So if you're born between the 1st and the 10th, you will get your benefits next week, which is the second Wednesday of the month. If you're born between the 11th and the 20th, you get your benefits on the third Wednesday of the month. And finally, if you're born between the 21st and the end of the month, your Social Security and SSDI benefits will be paid on the fourth Wednesday of the month. If you're on SSI, you should have received your benefits already because it happens on the first of the month, unless the first falls on a weekend or a holiday. So if you haven't received your SSI benefits yet, there's a problem. Stay till the end of this section. I'm going to talk to you about why your payments may not have hit your account. Now, there's a whole category of people that get their benefits on the third of the month. If you live outside the United States, if you receive both SSI and Social Security retirement benefits, if your state pays for your Medicare premium, or you file for Social Security before 1997, then you are supposed to get your benefits on the third, unless the third falls on a holiday or a weekend. So here's the schedule, the Social Security payment schedule for May 2025. It also includes disability benefits for SSDI. On May the 14th, which is next week, Wednesday, payments are going to go out for those whose birthday is between the 1st and the 10th of the month. And on May 21st, a week after, payments are going to go out for those whose birthday is between the 11th and the 20th. And finally, on the 28th, payments will go out for those whose birthday fall between the 21st and the end of the month. As I mentioned, if you're on SSI, your payment should have gone out already on May the 1st, which is a Thursday, and May the 2nd for those who live outside the United States, receive both SSI and Social Security retirement benefits, those whose state pays for their Medicare premiums, and if you file for Social Security before 1997. Now, there is a possibility to get a second check those who are on SSI benefits are going to get a second check in May. It is your June check being paid on May the 30th. Why? Because June the 1st is a Saturday. And so the business day before is May the 30th. And so you're going to get two checks. If you're on Social Security, Supplemental Security Income Benefits, you're going to get two checks in the month of May, one on May 1st and one on May the 30th. Now, if you don't get your benefits for whatever reason, wait until 3 days, 3 business days. And if nothing happens, if the money does not appear in your bank account, then there is a problem. You have to call the Social Security Administration to find out, because you may be in an overpayment situation. And if you've been paying attention to the news or been watching our channel, you know that there's a new overpayment rule that just went out. And if starting in March the 27th, if you end up with an overpayment situation with Social Security retirement benefits or Social Security disability insurance or supplemental security income, your Social Security check is going to be withheld. 100% of it, that was the original change that they made. They were going to take 100% of your Social Security check until they've paid off the amount you owe in overpayment. Well, we made a video about that and told you guys to call Social Security, call your congressperson, call your senator, and make a lot of noise that taking 100% of your check to pay an overpayment is going to create a lot of challenges for seniors and people on disability. And they heard you. They backed off, and now it's going to be 50%. I mean, that's still high, but it's not 100. So that's a little bit of progress. But I think it's important to continue to make your voices heard, because they do listen, as long as a lot of people make noise and express their displeasure about some of these policies that are coming up. So we've heard a lot about President Trump and what he's going to do for seniors, and a lot of you have been waiting. Okay, what is possible this year in 2025? Well, I'm going to give you 10 ideas of things that he can do to improve the lives of seniors. These are from research that I've done about proposals that have been thrown around in Congress, and I've picked the best 10 that I think the president should get behind to help seniors improve their life. The first one is, let's talk about why the president should pay attention to seniors, because they are a big voting bloc. 74% of seniors age 65 plus voted in the 2020 election, making up 30% of the electorate. And people age 50 plus contribute 56 cents for every dollar that's spent in the United States. That's a big, big power base. And that figure is projected to hit 61 cents by 2050. And seniors support about 88 million jobs with their spending. And seniors are also increasingly entrepreneurial. 25% of new businesses started by individuals between 55 and 64 in 2018. That's up 15% 2 decades ago. So you can see seniors are a big, big power base. And older adults contribute about $745 billion annually through unpaid caregiving and volunteer work, bolstering the economy and communities nationwide. So, what are some of the things that the president can do to help seniors this year that can actually make a difference? The first one is protect Social Security benefits. Removing federal taxes on Social Security benefits will allow retirees to retain more income. Currently, up to 85% of benefits are taxed for higher income retirees, generating vital revenue for the Social Security, but causing a lot of pain for some seniors. Adjusting COLA to match inflation will also help. It will make sure that seniors maintain their purchasing power. In 2025, COLA was just 2.5%, which an average of $50 was just not enough money for the 72.5 million Americans that get Social Security and disability benefits. Another area the president can help is investigate fraud. Addressing improper payments in fraud can also help protect Social Security for seniors, and raising the income threshold, increasing income threshold for benefit taxation. If you don't know what that means, it means that currently you can only pay Social Security taxes, or you're required to pay Social Security taxes on income up to $176,100. And this proposal is to remove that cap so that everybody making any form of wage will have to pay Social Security taxes, whether you're a millionaire or billionaire or making $50,000. Everybody pays the same percentage Social Security tax. The next idea is to expand Social Security and Medicare coverage. Seniors spend about $4,000 annually on out-of-pocket healthcare costs, with prescription drugs being a major expense. And the Inflation Reduction Act put a $35 minimum or maximum cap on insulin. And this proposal is supposed to expand that to other drugs so that seniors that are spending $4,000 on average will benefit from the $35 a month cap on certain medications. Another area is to enhance preventative care. Preventative services like cancer screening and vaccinations reduce long-term healthcare costs and improve outcomes. Expanding Medicare coverage. Here's a big one. Expanding Medicare coverage for dental, vision, and hearing care could address unmet needs for 75% of seniors. And then supporting long-term care. Over 70% of Americans age 65 would need some form of long-term care, but Medicare does not cover it. Including limited long-term care in Medicare Advantage plans could reduce financial strain on families and seniors. And then capping out-of-pocket costs. Medicare beneficiaries currently face unlimited out-of-pocket expenses for Part A and Part B services. Implementing a $5,000 annual cap will protect seniors from financial hardship during serious illness and hospitalization. The third place the president can really impact is strengthening Medicare for seniors. Medicaid funds 62% of nursing home residents, but is being threatened by budget cuts. If you've been paying attention to the news right now in Congress, they have a big bill to do a devastating amount of cuts to Medicaid that is going to impact seniors and people on disability and is going to cause a lot of hardships, especially for seniors in rural areas where rural hospitals depend on Medicaid to survive. So this is an area that the president could get behind. Address housing shortages. Nearly 10 million seniors spend more than 30% of their income on housing. So this is an area where measures like expanding rental assistance can help. Only 1 in 4 eligible seniors receive rental assistance due to funding shortages. Increasing funding could help an additional 2 million low-income seniors afford stable housing. And then reducing health inequities. Rural seniors face significant barriers to healthcare, with 20% living more than 30 miles from a hospital. And nearly 3 million eligible seniors are not enrolled in Medicaid due to complex application processes. These are some areas that changes can be made that will have real immediate impact. 1 in 4 seniors struggle with mental health issues, yet only 3% of Medicare spending goes towards behavioral science health services. So you can see there is a big opportunity to address mental health among seniors. And then drive down prices of drugs. Allowing Medicare to negotiate more drugs with more partners will help save $78 billion in out-of-pocket costs annually for seniors. That's going to be a big, big saving. Seniors often face surprise medical bills averaging $750 per month. Making sure that seniors don't get surprise medical bills by ending surprise billing practices is going to be a big, big help here. And implementing a $2,000 annual out-of-pocket cap for Medicare Part D beneficiaries will protect seniors from financial hardship. That's another area that can help. Long-term care. Improving long-term care. Nursing homes with adequate staff have 30% fewer cases of neglect and abuse. This is serious. Over 41 million Americans provide unpaid caregiving for adults, saving the government $470 billion annually. By paying these family members or friends who are caring for these elderly people for free and incentivizing them to do the work, this is another area that the government can help make improving long-term care a priority. And then boosting retirement savings. Raising IRA contribution limits from $7,500 to $10,000 would help a lot of seniors. Nearly 1/3 of Americans age 55 plus have no retirement savings at all. This is an area that the government can incentivize people. Offering additional tax breaks for contributions to retirement accounts would encourage savings and ease future financial burdens. And then combat elder abuse. Elder abuse affects 1 in 10 Americans age 60 plus, yet only 1/3 of cases are reported due to lack of awareness or fear of retaliation. Older adults lose over $3 billion annually also to financial scams targeting their savings and their benefits. Fighting fraud and fighting senior abuse is going to be an area that Congress can easily take on and pass a law that the president can get behind. And then making sure that seniors do not face cuts from Doge. Elon Musk has been running rampant around the government, cutting everything he can find. And that is affecting a lot of services, especially the Social Security Administration. They've already cut 90% of regional staff, and they've spent a lot of time cutting programs that are going to affect seniors. Doge-driven policies risk undermining Social Security and Medicare, programs that provide more than half of income for nearly 40% of Americans. Cuts to Medicaid funding could jeopardize nursing homes for 2/3 of residents who rely on it. So this is another area where seniors can be protected. So I hope this was helpful to you. Let me know which of these jump out at you in terms of helping seniors this year in 2025. We're not talking about 2026 or 2027. What can be done this year to improve the lives of seniors? Let me know your thoughts about all of this in the comments below. And let's talk about Medicare for a quick second. You know, I've been talking about Chapter Medicare and how they can help you get Medicare costs under control, but also help you pick the right plan. There is a lot going on with Medicare, 24,000 plans out there. Choosing the right plan for you can be challenging. That's why 90% of seniors are in the wrong Medicare plan. Well, Chapter is here to help you, and we've partnered with them because their main goal is to make Medicare simple, help you understand your options, choose the right plan, and then be able to leverage and use your Medicare benefits to your advantage. Now, a lot of you are been asking, why are we doing this? Well, it's because these guys are legit and they're coming at this problem from personal experiences. One of the co-founders of Chapter Medicare has watched his parents struggle to navigate the Medicaid process, and they wound up paying premiums that were hundreds of dollars a month more than they ought to have been. He realized what a terrible experience this whole process was and decided to do something about it. So how can they help you? Well, Chapter Services is free to you, but they are unbiased advocate for you. They are not there to advocate for the insurance company. They're there to advocate for you. And in addition to helping you save $1,100 a year, they do not pay their agents to push setting plans. They are there to help you see what is available to you and pick the best plan. And they can see all the plans that are in your local area. They are the only advisory company with access to 24,000, all of it, all the plans that are out there. They can see it all and help you pick what plan is good for you in your area. And these are the people you're going to be talking to when you call. So these are real licensed agents that are working for Chapter that will you be talking to. This I pulled from their website directly. And when you call them, here's what they will do. They will show you every Medicare option, including detailed information about which doctors, specialists, prescription drugs, and hospitals that are covered under each plan, and then how much the co-pays are. How much are you going to pay out of pocket? And then they'll help you compare all that plan to traditional Medicare. So their service is free to you. Call them 539-205-2147 today, but you have to act soon because the window for you to sign up for Medicare or change plans may be closing. Or you can go to the website askchapter.org/insider and sign up. They're highly rated by the Better Business Bureau. A lot of A+ ratings, 5-star reviews you can find online, and they'll save you a lot of money. So call Chapter today. So that is what I wanted to bring you today. I hope you found value in it. And if you did, hit the like button, hit the subscribe button, and I'll see you in the next video.